Good evening and welcome to another edition of Budget in Focus. This evening we speak with Minister of Health Dr. Frank Anthony, who will give us a little more insight of what is going to happen in the health sector for 2022. Minister of Health Dr. Frank Anthony, good evening.
Good evening to you.
Now, Minister, before we get into the health sector specifically, let's talk about the overall thought of the budget. Your thoughts on Budget 2022?
Well, I think it's an excellent budget. I think His Excellency, the President, Vice President, Dr. Ashney Singh, and all the others who have helped in the crafting of the budget really put a lot of thought into it, because I think for every sector, we would have seen allocations being made, not just to improve the sector, but really all these allocations were aimed at improving the welfare of people in this country. And I think when you look at it, it's very comprehensive, and it would certainly put Guyana on that trajectory of modernizing it as quickly as possible and getting people, those persons who might be in poverty, get them on that road to prosperity. And that's what we want. We want our future to be bright, and we want to lay that foundation now. And I think this budget is really laying that foundation for that brighter future that we've always aspired for.
And Minister, to talk a little bit about the health sector and what we are to expect in the health sector for 2022, tell us a little bit about that.
So within the health sector, we are trying to modernize it as well. And to do so, we'll have to look at a number of things in the sector. One of it would be to make sure that we have a modern legislative framework in which the health sector would operate in. And you would have seen that we have started passing new legislation to make sure that we can modernize that legislative framework. Just recently we passed the organ and transplant bill. Very shortly we want to bring the mental health bill, suicide prevention, a new public health bill, and so forth. So we have identified in the sector close to 20 different pieces of legislation that we'll be working on, and once we complete that and bring them to Parliament, you would then see a new modern architecture for health, and so that's laying that legal framework. In addition to that, what is very important, that when patients come to the hospital, they want to get good quality health care. And I think a lot of patients get frustrated when they come to the hospital, they cannot get medication. When they come to the hospital, if they need to get some lab work done, they cannot get that lab work at that hospital. Or if they need to get an X-ray or a CT scan, it's very challenging for them. So what we are trying to do is to make sure that we have a network of hospitals that are modern, that would have all the infrastructure. So if you come to the hospital and you need care, you need whatever tests you need, you will be able to get that laboratory test done right at the hospital. And you don't have to wait an extraordinary long time before you get back the results. If you need an X-ray or a CT scan, you must get it almost the same time.
Right.
So that's the concept that we're working with. We want to reduce patients' waiting time and so forth. And therefore, for each of these regions now, we are developing services contract to make sure that patient waiting time is going to be reduced. So you'll see a lot of these types of things coming into effect during this year. But in this particular budget, we have allocated quite a lot of resources to build the infrastructure within the Ministry of Health. So you would have seen that there are about 8 new hospitals that are going to be built. So one hospital is going to be at Skeldon. Another one would be at Bath in Region 5. Another one would be at Enmore. Another one would be at Little Diamond. Another one would be at Dekendron, in that Tushin area, Dekendron Tushin area. Another one would be in Anna Regina. Also, the West Demerara Hospital, we are going to do back a section of that hospital to make it quite modern. So it's not repairing the old building, but building a completely new structure within the hospital compound. And then the Bartica Hospital will also be building new structures so that we can have more efficient services at in Bartica. In addition to that, we are also going to be building a new hospital for children and mothers. So this is the new pediatric and maternal hospital that the President has been talking about. And this is going to offer very specialized care to children that need such care. So for example, if a child needs specialized care because that child has cancer, then that child would be able to get that care at this hospital. So we'll have oncologists that would be working at this hospital. If a child, for example, need cardiac surgery, and you know we have a number of kids who would have various defects in their heart and so forth. Right. And if they need that type of surgery, this hospital would be able to perform such surgery and so forth. So you would have a lot of specialities that would be in this hospital, and we'll provide world-class care at this hospital. Already we are partnering with a number of international institutions who are bringing in those skills and helping us and training our local doctors so that when that hospital is up and running, those persons, local persons, would be able to run those services. So we are putting that mechanism in place. So lots of infrastructure work, but it's all geared to improve the quality of people's lives. And that is what we are aiming to do. And this is coming, if you recall, last year, we were able to repair the Diamond Hospital, where we converted it into a smart hospital. We also have finished now the Lenora Hospital. We have completed the Lethem Hospital. We have just completed the Mabaruma Hospital. And so all of these hospitals we have done over the last year, plus we are now adding totally new facilities that would have some of the best services that you can think about. Diagnostics, imaging, and other services would be in these hospitals.
And Minister, one of the other highlights that came out of the health sector, we're expecting to see in the health sector in 2022 is a one-stop shop diabetic clinic in Lusignan. Now, tell us, how can that particular clinic benefit the residents in that area and Guyana as a whole?
Well, it's not only for the residents of that area, because, you know, diabetes is a very prevalent problem in Guyana. Some of the international organizations would have estimated that there are probably about 60,000 persons in Guyana who suffer from diabetes. Now, that sounds like a lot of people, but we don't know for sure, and therefore, even if it's 30,000, it's still a lot of people. Now, for a diabetic patient, you need to make sure that the blood sugar is adequately controlled. A lot of patients don't control their blood sugar very well, and that can lead to all kinds of complications. Those complications would include having kidney problems, having problems with your eye. You can get blind because of diabetes. You can lose feeling in your feet and extremities, and that would have all kinds of other complications, because if you can't feel, then you can walk on something that is sharp and you can get your feet cut. Right. And then you get a sore ulcer, and then eventually you start by losing maybe a toe, then you lose part of your feet and so forth. So what we are seeking to do here is to make sure that we put a center where all the services that you need, a diabetic patient would need, they can come to this particular facility and get all those services. So what are some of those services? When you come in, you will be able to see a doctor. If it is necessary, we'll get you to see an endocrinologist. That's somebody who specializes in diseases such as diabetes. In addition to that, a very important part of diabetic control is your nutrition. And so we'll have people who are trained in nutrition counseling to work with that patient to make sure that they understand what to eat, when to eat, how to eat, and so forth. So you'll have a whole set of people working in nutrition counseling, and that's very, very important. In addition to that, if that person requires, say, an eye test, that eye test would be done right on the site. If that person requires, because they have some ulcer on the foot, requires foot care would be offered right at the site. If that person requires a shoe that can help to reduce the weight, the impact of the body, then we would have some section there that would help with building such shoe to help spread the weight so that the person can walk comfortably. If that person requires, because of an amputation, they require prosthesis, then we'll be able to refer that person to the Talmareed Center where we are able to do prosthesis. So it's a whole combination of services that would be offered. But the most important thing here is to help the patient to get adequate control of their blood sugar. And if we can do that and do that well, then a lot of these complications can be prevented. So the idea here with this particular diabetic center is to pilot it. Once it starts working and it's working well, we are going to replicate that in different parts of the country. We have, as we have started this project, we have been in touch with the Pan American Health Organization and the WHO. They're lending us some technical support. There is centers like this in other parts of the world. In Brazil, there is such a center. In Haiti, they have one. So we had some of these international experts who would have visited Guyana, work with the staff, talk to them. We are now setting up all the protocols that would be in place when this place is finally completed. And we're just working on it. So there are lots of things that are happening, and I'm sure that the diabetic patients would be pleased to note that when they come to this center, they can get all the services that a diabetic require, including there will be a pharmacy there as well.
Wow.
So if you need your medication, you're going to get your meds there as well.
So, Dr. Anthony, as we talk about diabetes, there's another specific initiative that was placed in the budget for this year in terms of dialysis. Tell us a little bit about that program and what we can expect from it.
So right now, we have maybe at all the different clinics and so forth, we estimate there are probably about 300 or so dialysis patients. These are patients who would, all of them would have what is called end-stage renal disease, meaning that the kidneys don't function, right? And because of that, to remove the impurities from the blood, you really need to get hooked up to a machine, and that machine would help to purify your blood. If you don't get this dialysis done, then the toxic substance that your body generates would eventually poison you. So it is absolutely essential that you get your dialysis done if you have end-stage renal failure. Now, some patients are, well, quite a lot of these patients, initially they would be able to afford dialysis, But then as their disease prolong, many of them don't have money to sustain the treatment that they need to get. In some cases, people would require to have 3 sessions per week. And in addition to those 3 sessions, they have to buy a special medication, and they have to use that maybe every 2 weeks. Plus, every 3 months, they have to get a set of blood tests to check kidney function, to check other parameters of the blood, and so forth. So when you combine all of these things, it's quite expensive. So what we are going to do, what the government is planning to do, is to help these patients. So initially, the program of the government was to give a one-off 360,000 Guyana dollars, and that's it. But we have changed that now. So each patient would be able to get about $600,000 a year, and that should provide for all the sessions, all the dialysis sessions that they need to get. We would work out a strategy where the patient's choice, whichever dialysis center they want to go to, it's up to them. So we'll work out a mechanism where they would decide who would be their dialysis provider. And the government would pay for these patients to have access to dialysis. In addition to that, the medication that they would need, one of the things that the ministry would be doing, we would be procuring that medication. It's very expensive. It would cost per patient per week, every 2 weeks when they need it, I think about 9,000 Ghana dollars. So the ministry is going to procure this medication, and we'll make it available to the patients who need it. And we would also commit to providing for these patients the blood tests that they need. So they can come to any one of our laboratories and be able to access the tests that they need. And that, I think, would help a lot of these patients. So this is what we are doing for the dialysis patients. Hopefully, as we do more preventative programs, we will reduce the amount of persons who would have end-stage renal failure. And then even with those who have end-stage renal failure, if they are able to get a donor, they can probably get a kidney transplant. So we are working in different aspects of these problems, but hopefully we can do more prevention, and once we prevent these cases from happening, then less people would have need for these types of services.
Minister Anthony, let's turn our attention a little bit to COVID-19. We've learned from the budget that just around $6.8 million has been allocated to the COVID-19 response plan. What can we see happen in 2022 in our fight against COVID-19?
Well, some of that, the money is going to go to different things in terms of the COVID fight. You would recognize that one of the things that we have to do very often is to test people. Right. And so we have made a provision within this budget to do a lot of testing. So we have in the budget for antigen testing, PCR testing, and we are also looking at home testing devices. Now, just to put this in perspective, for the whole of 2020, we did 38,000 tests. That's the whole of 2020. So since the first case on the 11th of March to the end of 2020, it was about 38,000 tests. In January of this year alone, as of yesterday, we have completed 78,000 tests. Wow. So in less than a month, we have completed 78,000. So that's the magnitude and the scale with which we are testing people. And so we have to allocate a lot of resources to do testing. Now, in addition to testing, one of the other things that we are doing, when people, while with this Omicron variant, you'll have a lot of people might get a milder form of the disease, there's still a lot of people who are coming into hospital So as of yesterday, we had 131 people in our hospitals. So we still have people coming into hospital, and unfortunately, a lot of these persons are either unvaccinated or or they have comorbidities, meaning underlying illnesses, and therefore they'll have this severe form of COVID, and that can be challenging. Some of them would recover, but unfortunately, some of these patients would not recover, and that can be challenging. Now, for these patients, there are now medications that are becoming available. We started using remdesivir about mid last year, and we continue using remdesivir. Remdesivir is a very expensive drug, but we are nevertheless buying it and offering it to the patients who require it. Another drug that we see that has been effective is a drug called baricitinib. And we start using that, I think, early in December. And then I think early in January, I saw the WHO now approving it as one of the drugs that you can use with COVID-19 patients. But we had started early, and we got very good results. There are two other drugs that have now come on the market. One is Paxlovid by Pfizer. And again, we are trying to have access to that medication. And there's another drug from Merck, molnupiravir, and we are also trying to get access to that medication. So these things don't come cheap, and we have made an allocation so that once we can have access to it, we'll be able to buy these medication for the patients who would need it. In addition to that, you would recognize that when people come into the hospital, they require oxygen. And so we have set aside monies to make sure that we have an adequate supply of oxygen for these patients. Some patients require 15 liters, 16 liters a minute, and therefore it can be very costly, because imagine having a patient on a ventilator for 10 days, right, and you're doing 16 liters a minute. It can add up quite quickly, and therefore we have to make provision for these types of patients. In addition to oxygen, of course, we want to prevent the disease from happening, and to do prevention, we require to have vaccines. Now, we have been able to secure vaccines for our adult population, so anybody 12 years and over, we have vaccines for them. But the children 11 to 5, we are now trying to get those vaccines, and Pfizer has been making a special vaccine for that age category, and we're working very hard to source that particular vaccine. In addition to that, by the first quarter of this year, Pfizer is expected to send their dossier regarding a new 3-dose vaccine for children between 5 to 6 months, 5 years to 6 months. And again, as those vaccines become available, we would want to access it for our children. So we are already thinking along those lines, because we want to keep people safe. Right now, there's no vaccine that is available for children 11 years and younger. So we are looking at different possibilities. In addition to all of this, we have to get PPEs, face masks and gowns and hair caps and shoe covers and all these things. So another set of resources are going to go to buy those things that are necessary. And we'll want to do more outreaches and so forth. So it looked like a lot of money, but when you finish allocating these things and trying to get the various things that we need to fight COVID, it can be very expensive. Fortunately, over the last year, we have been able to invest in a lot of equipment, We bought a lot of ventilators, we bought a lot of cardiac monitors, beds, and so forth. So right now, every one of our regional hospitals, they have equipment that can be used for COVID-19 patients. And I guess when we return to some semblance of normalcy, that we can repurpose these types of equipment for other medical conditions.
Dr. Anthony, we spoke about the construction of new hospitals in the year 2022 and onwards. But we haven't spoken about the rehabilitation and further improvement of the current hospitals that we have. And I know that there's an allocation for that. What can we expect to see for our hospitals like the Georgetown Public Hospital and all of these other hospitals that are already here?
So for the existing hospitals, we are going to do a lot of rehabilitation. So the New Amsterdam Hospital would undergo some rehabilitation works. We are going to do work at the Georgetown Hospital as well. And there are some other hospitals that we are looking at where we'll certainly be doing some works on them. So it's not only building new, it is also repairing the existing. In addition to the hospitals, one of the things that we'll be working on, the health centers.
Right.
Because we have received a lot of complaints with some of these health centers. When people come in the morning, and despite telling people, the health center would open at 8 o'clock or whatever time, people would come sometimes from 6 o'clock and they're standing out there, right? And when they come early, if it's raining, at sometimes the health center, it does not have a shade or it does not have a shed, does not have benches outside and things like that. So people, especially old people who come to these facilities, when they come, they have to wait outside of the health center with none of these facilities, right? So we'll be doing a major set of enhancement where we'll be fixing these health centers so that if people come early, they can wait in a more comfortable setting. In a lot of cases too, what we found is that in the health centers themselves, in the compound, there isn't any maybe toilet or something, so people come there, they want to use the washroom, and they don't have access. So we want to fix these things. These are little things, but it's going to help people to be a little bit more comfortable. And so we have set aside some monies to do some of these fixes across the country.
Dr. Anthony, $73.2 billion roughly has been allocated to the health sector, and one of the programs we know we'll see rolling out in 2022 is the heart program, the heart treatment program. Tell us a little bit about what is expected to happen in that program for 2022.
So right now we are able to assist adults. So if somebody got a heart problem, they would go to the Georgetown Hospital. They would be assessed by the doctors there. If they need a stent or they need some form of some other cardiac intervention, they'll be able to get it at the Georgetown Hospital. In many instances, a lot of those patients cannot afford the cost of the intervention. Sometimes like a stent would cost probably about 200,000 Guyana dollars. Patients can't afford it. So the government has been paying for these things. And we spent probably about 300 million or more last year to assist patients for various things. In this instance with cardiac surgery, we also assist patients who would need radiotherapy and so forth. So we have a program where we are able to assist patients. But the cardiac patients, a lot of cardiac patients have benefited from this program. And most of this went to CHI, the Caribbean Heart Institute, and the government has been paying for these services. Now, CHI has been dealing a lot with adults, but not so much with children. So what we are doing now, we have been working with another group of people who previously was in Guyana. They came here, they had set up a pediatric cardiac program, and they were able to do a lot of surgeries here before. Now, under the APNU, the whole program collapsed. So during their tenure of government, not much happened and the whole program disappeared. So what we are now trying to do is resuscitate that program. And we have created a waiting list of the children who need such surgery. That list is growing by the day. So I think the last time I checked, we had more than 150 patients who require cardiac surgery. And so instead of trying to send these children abroad where it's going to cost about $30,000 maybe per child, we can do that surgery right here, and it's going to cost probably about $6,000. So we are putting that program in place. We are going to buy all the equipment to make sure that we can do cardiac surgery here, and we'll have an international team of surgeons and nurses and so forth, along with the local doctors who will be working to do these cardiac surgery for the pediatric patients. And we are hoping that once we start the program, that we'll be able to clear this backlog of patients, and hopefully in the next couple of years, we'll reduce this burden that we currently have. So we are starting this year. That's what is important, and hopefully we can clear this backlog as quickly as possible.
And finally, Minister, the government has placed significant emphasis on the training of the citizenry and the further education of the citizenry. What can we expect in terms of training and further education in the health sector for the year 2022?
Well, in the health sector, we actually have a lot of training programs, and I really want to encourage young people to think about a career in health. So we have, from maybe the lower level, we have community health workers, where a lot of people can be trained to become a community health worker. We have the MEDEX program, where people can be trained to become MEDEXs. We have persons who we are training to be pharmacy assistants, and a whole host of other categories of people, laboratory assistants, rehab assistants, and so forth. So we have a whole series of professionals that we are looking to develop, and we run these programs. In addition to that, we have nursing programs. So we have a nursing assistant program, we have a registered nurses program, we have a midwifery program, and then we have some specialty kind of nursing. So if you want a cardiac nurse, they have to go through some specialized training. You want a psychiatric nurse, they got to go through some specialized training. All these programs we run in the ministry, and therefore within the ministry every year we are able to train, I would say, more than 2,000 people every year. So that's one set of programs. Plus, for medical doctors, we have been, the University of Guyana would normally train the doctors at the undergraduate level. But between the Ministry of Health, the Georgetown Public Hospital, and the University of Guyana, we have a postgraduate program that we are running. And we have about 12 different specialities where we are upgrading doctors' skills. So internal medicine, obstetrics and gynecology, orthopedics, surgery, anesthesiology, and so forth. So these are people who have graduated already, and they're now into this specialized program, and this is now for a 3-year period, and then they become a specialist in this area. So that has been an ongoing program, and we continue to expand that program. Right now we are also looking at other areas where we need to train people, and so among those other areas would be, we recognize that we buy a lot of equipment However, we don't have skilled people who can repair these equipment. So we are working with one of the universities in the UK, and we'll be doing a biomedical training. So the first level is to train people to get like the City and Guilds certificate level, and this would be in biomedical engineering. And then later on, if they want to go to a higher level, those options would become available. So this year, we are going to train 40 such persons. We have space for 40 persons, and we are going to work with them, train them, and then employ them because we need them in the sector. And we are going to expand these programs because we need biomedical technicians in each one of our hospitals. Right now, a lot of those services, we have Cuban biomedical technicians who would come to Guyana to render support, but we want to train our own people here, and this is an opportunity for persons to get that training. So I really want to encourage young people, when you see these ads come out in the newspaper, please apply, because we are looking for bright young people who we can train to help us in the health sector. And there will be all kinds of training. So whether it's nursing, community health worker, medics, pharmacists, you know, we need a lot of people, and we are creating lots of opportunities for people to get training. And I think it's very rewarding when you can work in this sector, see somebody who's really sick and provide care for them, and then see how, you know, they get better and so forth. So it's a really rewarding sector to work in, because at the end of the day, we are helping people in a real way.
Minister of Health, Dr. Frank Anthony, we want to thank you for joining us this evening to take a microscopic look at what is happening in the health sector for 2022. For more information, feel free to join us and look at our DPI page and our social media platforms for more information on Budget 2022. For DPI, I am Shaquan Gill saying goodbye for now.